defect. Here, I have to discuss with you the visual field defect to learn without memorizing why the middle cerebral artery stroke will affect the visual field of the patient. Take a deep breath because this is a very tough one and you have to learn it. You have to learn it. This is a very common concept. The visual field defect, I'll get this description here and in the ophthalmology chapter and also in the anatomy chapter. So take care. First of all, if you see these fields, here I have what? Here I have the eyeball. Then this is the optic nerve. Then comes from the optic nerve to the optic chiasma. And from the optic chiasma to the what? To the lateral geniculate body, then the optic tract, then we'll come to the end of the field. Here I am discussing about the nasal fibers and the temporal fibers. You have two types of fibers here. You have nasal fibers, which is here, this is the nose of the patient. Here, the nose of the patient. Here, the temple of the patient. Here, the temple of the patient. So the nasal fibers are transferring what field? What field of vision? The nasal fibers are transferring what field of vision? They are transferring the temporal field of vision, which means that they are transferring the outer part of vision. So the outer part of your vision are transferred by the nasal fibers. So what do you think about the temporal fibers here? The temporal fibers here are transferring what kind of vision? Nasal. So the temporal fibers here are transferring what field? The nasal field. Okay? Here I'm trying to clarify which field are being transferred with which fibers. So if here, doctor, discussing this concept, and here I have what? Here I have the temporal field. Here I have the nose of the patient. Here I have the nose of the patient, doctor. Okay? And this is the nasal fibers transferring the temporal field. And this is the temporal fibers transferring the nasal field. What do you think in the optic chiasma? Which decussate in the optic chiasma? The nasal fibers or the temporal fibers that decussate in the optic chiasma? If you take care here, the temporal fibers doesn't decussate, but the nasal fibers decussating in the optic chiasma. So what do you think, doctor? What do you think? If here I have a craniopharyngioma, if here I have a lesion here compressing which fibers? What do you think? Which fibers are being compressing here? The both nasal fibers are being affected here. Both nasal fibers transferring which field? Both temporal field. So whenever there is a tumor compressing the optic chiasma, you will find what kind of lesion in the field, what kind of field will being affected and blind? Temporal here and temporal here. So I have bitemporal hemanopia with what? With optic chiasma lesions. Is it clear, doctor? Is it clear, this concept? Is it clear?
Yep.
Yes.
So I have bitemporal hemanopias with optic chiasma lesions because I am compressing what? Both nasal fibers who are transferring both temporal fields. Okay? Coming up. So take care about these lesions with the fields. If I'm cutting all the optic nerve here, I will get monocular visual field defect like 1 sight or the ipsilateral blindness. But when I'm compressing the optic chiasma here, what I'll get? Bitemporal hemanopia, because the nasal fibers here are transferring the both templar field. So here I have what? Here I have, try to concentrate with me with what's called homonymous hemanopias. What's called homonymous hemanopias? If I have here lesion in optic tract, lesion in optic tract, or optic radiation, or occipital cortex, optic tract, optic radiations, occipital cortex, what do you think? What kind of fibers are being affected here? The nasal of what? The nasal of what? The nasal fibers of the opposite and the temporal fibers of the same side. The temporal fibers are transferring what kind of field here? The nasal. And the nasal, what transferring what? The temporal. And that's why you will get what? You will get temporal blindness, contralateral, and nasal blindness, ipsilateral, and that's called what? Contralateral homonymous hemanopia. Homonymous, which means the same eyes, the same field in both eyes, which is the right field. And contralateral because it's contralateral to the side of the lesion. Okay? So what's the difference between optic tract and optic radiation and occipital cortex strokes? There is difference between the three parts here. The optic tract lesion cause incongruent homonymous hemanopia. What's the meaning of incongruent? The meaning of incongruent means that both fields are being lost, but with no symmetric. Yani, which means that all this field being lost and some of this field being lost. There are no symmetrics between both fields. This is the optic tract lesion. The optic radiation will cause congruent, which means both fields, the same fields are being affected with the same pattern. This is optic radiation. But what do you think about the occipital part? What do you think about the occipital part here? It will cause something called
macular sparing.
Excellent. Macular sparing. It will cause homonymous hemanopia with macular sparing, doctor. Why macular sparing? Why macular sparing? Because macula have
double blood supply.
Excellent. Macula have double blood supply, and that's why you will see the field like this. You will see the field like this, doctor. In what? In occipital stroke. In what? In occipital stroke. So this monocular lesion in optic tract, this bitemporal in optic chiasma, this homonymous hemanopia in what? In optic tract, radiation, and occipital. But with macular sparing, this is the occipital. What's the difference between optic tract and optic radiation? One incongruent and the other congruent. Okay? So what's left from the visual field effect? Superior quadrantenopia and inferior quadrantenopia. This is the mnemonic. Inferior quadrantenopia comes with the parietal loop lesion, and superior quadrantenopia comes with the temporal loop lesions. What's here called central scotoma? What's the central scotoma here? Macular degeneration. The macula is affected. The focus of your lens, you are here trying to see our faces. You are looking to this lecture with your focus, with your macula. Whenever the focus is being blurred, this is central scotoma. This is a feature of what kind of disease? Multiple sclerosis. Multiple sclerosis will comes with optic neuritis and central scotoma. Take care. Macular degeneration, central scotoma. Take care. So what do you think if I told you that if I have a tumor compressing the optic chiasma, you will have?
Bitemporal.
bitemporal hymenopia because I'm affecting both nasal, which are propagating both temporal fields. What do you think? If I have a lesion here compressing equal bilateral, what kind of fibers will be affected? The both temporal, who are propagating which field? Both nasal. What kind of disease that may cause binasal hymenopia?
Hydrocephalus.
What do you think? Congenital hydrocephalus. Congenital hydrocephalus. Okay? Congenital hydrocephalus, we will compress both fibers by the same sequence because of the ventricles enlarged, which will compress the fibers in both sides in the same pattern. So congenital hydrocephalus will cause binasal hymenopia. Very, very smart and high yield information. Okay, doctor? This is the visual field defects. I hope that I get it clear. I hope that you understand it, not memorize it. I hope that you understand everything. Whenever it comes to you in the exam, you will solve it because it's a very high yield in the exam. So, what do you think
معلش
if
ممكن السلام عليكم راجعين الكونترالاترال هومونيموس الكونترالاترال
Yes, doctor. Yes, Dr. Rania. Contralateral homonymous hymenopia. Contralateral homonymous hymenopia. I have a lesion in the optic tract, in the optic radiation, and the occipital cortex. In the optic tract, optic radiation, occipital cortex. What kind of fibers affected? Ipsilateral what? Temporal. Contralateral nasal. What kind of fields affected? Contralateral temporal and ipsilateral nasal. So you will find what? You will find like this homonymous hymenopia in all these three kinds of what? Of lesions. In all three kinds of lesions, you will find homonymous hymenopias. Homonymous hymenopias, what the difference between optic tract, optic radiation, and visual cortex? The optic tract, incongruent. Why? What's the meaning of incongruent? You will find that both these fields are asymmetric. The patients complain of blindness, but not with the same pattern, not a symmetrical pattern. But in the optic radiation, it will be congruent, it will be symmetric. But
Doctor, what do you mean by a symmetrical pattern?
Symmetrical, I means that the field here will be all the half of the field will be lost, and in the other eye, you will get some blurring here.
Okay.
That's an optic tract. But the optic radiation, you will have to be symmetric in both fields. In occipital cortex here, you will have macular sparing because macula have double blood supply. It will not be affected by stroke here. I told you about these visual field defects. Why? Because if you have a stroke in the middle cerebral artery, all this kind of stuff you will have. You will have visual field defect because you are affecting what? The optic tract, the optic radiation, maybe the posterior part. So whenever you have a middle cerebral artery stroke, whenever you have an occipital stroke, you will find that the patient complaining of what? Visual field defect in the opposite side, visual field defect in the same side and in the opposite fields. So whenever he said